Hi guys, John Gutierrez here, and now we'll be inspecting and packaging our Ethicon laparoscopic grasping forceps. We are now in low-level PPE as we are in the clean side, and being so, we'll be properly clean and would not be exposed to any pathogens. Just a face mask and a scrub cap will do to prevent transmitting our own microbes. Once the load has been appropriately cooled down post-washing, we will carefully remove our graspers from the rack, checking that the water channel port wasn't detached during wash before unplugging. We take it to our bench and inspect the exterior condition for any noticeable damage that it may have undertaken in the wash, as well as any gross soil that may not have been removed in pre-cleaning. Again, paying attention to areas where it will most likely have been soiled during use, like the biting tip. Since it's a lumen instrument, we will also blow through the lumen with compressed air to remove any residual water from washing and to ensure there is no bioburden left within the lumen, ensuring that the other side of the lumen being aspirated is covered with a cloth to catch any microbes, bioburden, or microbe contaminated water. If the instrument has any soiling left whatsoever, we send it straight back to decontamination. Once it's deemed clean, we take it to be steri-peeled. When we arrive at the steri-peel station, we first check that our heat sealer is turned on and is at the correct validated temperature, appropriate for the sterilization that our packaging will undertake. We then select the appropriate size instrument protector for our chosen instrument to be steri-peeled, and then we choose the appropriate width steri-peel pouch to make our first packaging for our instrument. Once we gauge the appropriate length for our first pouch, we then seal one end, leaving at least 4 to 5 centimeter gap for the end user to easily peel the packaging apart. We then place the instrument handle side first so that once the packaging is opened by the end user, the instrument can be instantly used with the least hassle in fidgeting, and the instrument is still as sterile as possible. We then seal the other side of the pouch and trim any excess pouching so that our instrument can be as small as possible inside the sterilizer. In the case of our grasper, this instrument will be double pouched, so we just follow the same procedure for the second pouch as we do on the first, ensuring that the inner pouch is facing the same direction as the outer and it isn't kinked or folded in any way whilst inside the outer pouch. We also ensure this by choosing an outer pouch that will just fit our inner pouch with as little space to move as possible. Again, we seal and trim the end of the pouch to make it as little as possible, and then we decide where to put our barcode in our pouch. In this case, we'll put the barcode closest to the handle without covering any sealing of the pouching. We then ensure that our barcode is fully placed and it is now ready for sterilization.